Hi everyone, this is your partner in business and personal growth, FCPA John Mudany. Welcome, Karibu. Welcome to this channel. Thank you so much again for tuning in again to our channel. Really grateful, and thank you most profoundly for this opportunity. Today again, I'm with Dr. Mudany, consultant pediatrician, and I thought we should discuss this thing that affects the babies and the mothers. And we're going to be talking about a very interesting topic. It reminded me, why did I think about this topic? I'm talking about breastfeeding. You know, as young people growing in Africa and in Kenya, as a young child born to a very young mother who had not known much, I was fed on mashed potatoes and porridge. And you know, that thing didn't even have sugar, didn't have anything. So it was so bad. So my mother would block my nose, and I tried to get oxygen. I gulp the porridge. And I still remember today how I got choked one time and coughed until porridge came out of my nose. And today I'm with Dr. Mudany to tell us about the importance of breastfeeding. How should we breastfeed? Should children be breastfed, or should we buy Cerelac, lactogen, mashed potatoes, and porridge and feed them? Daktari, welcome so much. I know you're very passionate about children. By the way, Dr. Mildred Mudany is a PhD holder from University of Tokyo Women University in Japan. She's also consultant pediatrician, got her Bachelor of Science from University, Bachelor of Medicine from University of Nairobi, Master of Medicine from University of Nairobi, and PhD from Tokyo, Japan. And currently she's the CEO of Help Reach Africa, and also the chair of council of Kisii University, but passionate about public health, running this organization Help Reach Africa that focuses on really HIV/AIDS, public health, and breastfeeding is one of them. Karibu sana daktari. Just welcome, and please take us through this. Is breastfeeding still relevant today?
Yeah, thank you so much, FCPA John Mudany, my husband. I'm glad to join your channel and just talk about a subject I think I'm very, very passionate about, that is breastfeeding. Breastfeeding is something that we all want to talk about because of the importance of the same. Breastfeeding is that act of putting a baby to the breast to be able to suckle and be able to get breast milk and feed on the same. Now, there are a lot of benefits of breastfeeding, but I just want to start by saying that we all need to encourage our mothers to do what we call exclusive breastfeeding for the first 6 months of life.
From so 6 months, only milk?
Yeah, from 0 to 6 months, only breast milk, and it is enough.
Okay.
I know there are a lot of people who have other ideas, and they think that that is not enough for the baby. And I do remember myself when I got my firstborn, my mother-in-law was like, oh, a boy child cannot be full with breast milk only, and we better introduce Uji, we better introduce this and that. But I said no. What the reality is that what the baby needs is only breast milk for the first 6 months. And every mother has enough breast milk for her baby within those 6 months, and it will be able to provide enough nutrition for the baby. So we encourage all mothers to do this, and you will watch and see just how healthy your baby is going to become. So I'm going to just briefly talk about the benefits of breastfeeding to the baby. You know, there's a lot of benefit. The breast milk is available because the mother is there, and the breast milk is just at the right temperature. So you don't need to heat it, you don't need to cool it. When you put the baby there, it comes and it's just at the right temperature. Normally, when the baby is born, right from birth, there is already a provision for that milk to come. When you put the baby on the breast to breastfeed, that act of suckling brings down the milk, what we call the milk letdown reflex, and that is caused by a hormone called oxytocin. So the milk, as soon as the baby puts the mouth in the grasp the nipple and grasp the breast to be able to breastfeed, the baby's that act brings down the milk, and there is enough milk for the baby to suckle. And there are a lot of benefits. Let me say that Having that milk at the right temperature is already a very good benefit. The other thing is that that milk has all the nutrients that a baby needs that early. The things that a baby needs, the nutrients, the antibodies, everything that the baby requires at that age is within that milk, and it is good. The other thing is that that milk is in a form that is digestible. So the baby can digest it well compared, for example, to the cow milk. I know there are people who, as soon as a mother delivers, they start looking for which cow has delivered in the neighborhood, and they start looking for milk to buy so that they can give the baby that milk. But I always say this: the milk from the cow is for the cow's baby. The milk from me and from the mothers is for the baby of that mother. So you better use your breast milk, if you're a mother, for your baby, instead of starting to look for milk from the neighborhood, from the cows, and giving your baby. Why? Because breast milk, the human breast milk, is in a digestible form. The cow milk is there, it is milk, yes, but a good part of it is not digested. It has a type of protein called casein. It is not easily digestible by the newborn, and the baby may take it and it will have other problems. It will cause diarrhea, it will cause respiratory illnesses, and the baby will not grow as well as the baby who is on exclusive breastfeeding. So that milk of the baby is in the best way for digestion, and we encourage you to do breastfeeding from the mother. The other benefit is that there is bonding. As a baby is breastfeeding, there is good bonding between the mother and the baby. There is a way that we recommend, and I wish I was able to demonstrate all this, but there is a way in which the baby should be held so that the baby is looking straight into the eyes of the mother, and the mother is looking straight into the eyes of the baby. And as the mother holds the baby in such a way that the arm literally supports the back of the baby, and there's what we call like ventral to ventral attachment.
How
yeah,
do you put it? Show it.
So I don't have a baby, but I can try and do something like this. Supposing this was a baby, you try and hold in such a way that you support the baby's back completely, and the head or the neck of the baby is resting on your elbow, and the baby is lying there, and you kind of support completely, and the baby's stomach is leaning on the mother's stomach, and that is what we call like ventral to ventral attachment. And when the baby is breastfeeding, what is supposed to happen is that the baby should not just take the nipple. The baby should take the nipple plus the areola. Areola is that dark area around the nipple, and when the baby grasps that well, then the milk comes down well. When the baby only picks on the nipple, the breastfeeding doesn't happen well, because that's not where the milk ducts are. So the baby needs to grasp both the nipple and the part of the areola. And when the baby,
do you put the whole, you push inside the mouth, or how does
you help the baby so that the baby is not just grasping only the nipple, but also taking a part of the dark part. So
some babies bite, and then mothers feel pain and they want to throw the baby away. How do you make sure the baby doesn't bite? Because it's so painful.
Let's start from the baby who is just born, has no teeth. So there's no biting at that stage. The biting comes a little earlier, and perhaps we'll deal with it. But should that happen, to answer you, there's a way in which you now touch the chin of the baby to kind of help the baby release the breast. When you touch the chin, kind of the baby releases the breast at that point when the baby is biting. And that is more for the baby who is now beginning to grow older, and maybe is beginning to teeth and is beginning to grasp that nipple as a way of grinding or rubbing on the teeth that is coming up, and maybe having certain sensations. Right. So the holding and the positioning of the baby for the breastfeeding is very, very important. And also the latch, the connection to the nipple is very important. Nipple plus areola, so that enough milk comes in. And that way the baby will be able to get enough milk and be able to breastfeed well. If a baby is breastfeeding and you hear some sound that goes like, now that means the baby has not latched properly. Yeah, there should be no sound. You should only hear the sound of swallowing of milk. But if you're hearing some sound like, the baby has not latched properly. So you need to connect again, help that mother, or the mother help herself to make the baby connect well to the nipple, so that the baby is able to take both the nipple and areola and breastfeed well. Now, breastfeeding brings bonding. This bonding that you see that is like for a lifetime between mothers and their children. This starts from pregnancy to the breastfeeding. And breastfeeding in particular brings a lot of bonding because as the baby is breastfeeding, as the baby is breastfeeding, then you find that the mother is looking at the baby is looking at the mother, the baby is also able to kind of feel the heartbeat of the mother. That's also good for the mental health of the baby. As the baby is breastfeeding, the baby is actually hearing the heartbeat of the mother, and that is also very good for mental development. Now, I want you to know that the milk that comes the first 2 weeks of life, that milk that is very thick, I know some communities even take it and discard it and say it is bad milk. That is the best milk. That is like the first immunization to the baby. That milk is rich in antibodies. And if a baby takes it, then the baby is actually very healthy. It's like you've given the first immunization to the baby through that breast milk.
It looks yellow.
It looks yellow, it is thick, and it is very, very good for the baby. So that is not for discarding. That is what the baby needs. And it is really imparting a lot of antibodies to the baby, and it's very good for the health of the baby, to protect the baby from illness. Now, there
doctor,
are also
we need to because
there
of
are
this
also advantages. There are advantages to the mother.
We do part 2.
Yeah.
So we, ladies and gentlemen, that has been very, very important, hearing from the doctor about breastfeeding. This has been part 1 of the benefits of breastfeeding, and we've just had the benefits of breastfeeding to the baby and the first milk, as the doctors passionately explained to us. We will stop there, this part 1, and we'll have another part 2, and we want to invite you to join us as we do part 2 of the benefits of breastfeeding, now touching on the mother. That is really, really, really something you need to know, so that you don't do the way the mother did to me some years back. Please remember to subscribe. Press subscribe. Send your comment so that the doctor can also comment, and watch for the second video, part 2 of this very, very important learning from the expert, the consultant pediatrician herself, Dr. Professor Mildred Mudany, talking about breastfeeding. Thank you, ladies and gentlemen. Welcome again.
Thank you.
Thank you. Thank you.